and secretion from this infected animal can result in infection with Ebola virus disease. That is one. That is from the wild animal to human being.
Okay.
Now we can also have woman to woman transmission.
Okay.
So how can we have that? An infected person, you have direct contact with either the body fluid. You are talking about body fluid in terms of anything coming out. Is it vomitus? Is it saliva?
Urine?
Is it urine? They are all body fluids.
Okay.
The blood itself that comes out of that particular person. The secretions, we talk about secretion, whether it's seminal fluid, all these, if you have direct contact with this particular product coming out of this person. But that would only happen if someone had a broken skin. Maybe there is a wound.
And then there is
or
an
through the mucous membrane kissing, and then the saliva is introduced into the other person. The infection can be contacted. So that is number 2.
Okay.
Number 3, which has also been documented, is having direct contact with the body of the diseased, especially the mourners. People have found, this person, I like this person too much. Let me give the last kiss to this person. Having direct contact with the body without washing this particular, hand before using it for any other thing. And even when we go to the hospital to visit the sick, and you have direct contact with the sick person, and you fail to observe personal hygiene, that can also lead to this particular infection. Finally, which is very, very important as well, people who have recovered from this disease, especially men, have been found to even spread infection because the virus still survives in the semen for about 7 weeks after recovery.
So they are supposed to be on abstinence after recovery.
It depends. That means that they are supposed to be.
That is it. So some discipline has to be.
And that is why this information is very, very important.
But Dokita, wahala dey o. Because as we dey talk bushmeat now, my mind just dey go for all those all those correct, pig wey dem don, inside the oha soup. So my problem now is, how are we going to tell our people to stay away from bushmeat for now?
Well, you see, the thing we happen be say, even now, I dey ask myself question. People wey dey hit this bat before, they no get this infection. Why dem get am now? Na that place na we go start from. Because the thing wey happen be say, the virus don dey with us now. Don dey for West Africa. And then be our brother and sister wey dey for West Africa, for Liberia, for Guinea, for Sierra Leone. And you know say Nigeria travel, they travel far.
They travel for
we
this country.
We dey do business to all these places.
Yes.
And when we do business, we go mix with the people there.
Now wow.
The thing be
or
say,
even marry them. Marry them, bring them come.
Yes. The thing be say, for now, as this thing dey plenty, we go just try comot from those things. No be say we no go eat am. But if you wan eat am, make we cook am well, because the people don say, from wetin people wey no book about this thing don say, they don say if you cook am well, cook your meat well as you dey cook am for Africa, e fit kill this virus, and we no fit, maybe we no go get this particular disease wey dey talk.
But to eat bushmeat now, e get sick caution. No be so. E get wetin see caution. See caution.
No be say you no go fit eat am, but make you cook am well.
Boil am. Not be the one wey you go just see for side of the road begin chop.
If you fit leave am for now,
it's better.
It dey better for us.
Àwọn èèyàn wa, àtòtò arére o. A fẹ́ kí eku lé gbọ́ kó sọ fún tòde. Ebola ó wà ní òde o. A sì fẹ́ kí dókítà wa kó tún fi yé wa ní èdè tiwa gangan, ká lè mọ àwọn ọ̀nà tí a fi lè yẹra fún àìsàn tó tún gbòde lẹ́nujọ́ mẹ́ta yìí. dókítà wa ẹ ṣàlàyé fún wa.
àìsàn Ebola nǹkan tó ń fà á òun náà ni kòkòrò tá à ń pè ní kòkòrò àwọn pé kòkòrò oríṣiríṣi òun ló ń fa àrùn sí ara wa ọmọ èdèèyàn. Ara ẹ̀ náà lè táwọn olóyìnbó ń pè ní bacteria. Ìkejì náà ni virus.
ẹ jọ sà a ní kọ́ọ̀lù kan ṣùgbọ́n ó tún ti lọ a tún ní text kan náà pẹ̀lú ẹ wà ní ọ̀dọ̀ bacteria virus ẹ máa sọ yẹn lọ fún wọn.
So virus tí ó ń fa Ebola àìsàn Ebola òun náà ló ń pè ní Ebola virus. Ebola yìí ó ti wà ní Africa láti 1976 tí wọ́n ti rí ní Democratic Republic of Congo láti gbà ló jẹ́ pé ó ti ń fa àjàkálẹ̀ àrùn. Àjàkálẹ̀ àrùn eléyìí tá à ń sọ sí bẹ̀rẹ̀ láti oṣù mẹ́ta sẹ́yìn ṣùgbọ́n eléyìí tó tún wá yọjú ó sì ń lọ láwọn ìlú tí à ń sọ ṣùgbọ́n tó wá ń burú sí ní oṣù mẹ́ta sẹ́yìn ilẹ̀ Guinea ìlú ní Guinea àti Liberia nìkan ni ṣùgbọ́n sì ó ti mú Sierra Leone ti Sierra Leone yẹn iná yẹn wá ń jó bí ìgbà téèyàn fi kerosene ó ràn gidi gan-an ni nǹkan tó wá ń fà á kì í ṣe nǹkan tó yẹ pé bóyá a lè sọ pé a fi bẹ́ẹ̀ mọ̀ ṣùgbọ́n léyìí tó pọ̀ jùlọ nínú àwọn tó jẹ́ ọ̀mọ̀wé ní ọ̀nà pé ká máa ká ìwé lórí virus òun náà ni pé àwọn àdán tó yẹ pé ó ń jẹ àwọn èso káwọn olóyìnbó ń pè ní fruit bats àwọn náà rí pé àwọn tó bá ti jẹ irú àdán wọ̀nyí wọ́n rí pé wọ́n máa ń ṣe kí ni wọ́n máa ń ní àrùn ṣùgbọ́n èyí tó yẹ pé ó tún máa ń ṣe pàtàkì jù ní pé àwọn ìlú tí ó ti ń ṣẹlẹ̀ ní àwọn orílẹ̀-èdè tá à ń sọ wọ̀nyí wọ́n jẹ́ pé àwọn ìlú tó pọ́n bóyá wà ní abúlé tí wọ́n súnmọ́ bí tí igbó tó pọ̀ sí gan igbó kìjikìji àwọn ni wọ́n yẹ pé wọ́n ń sábà ní àrùn yìí níbi tá a ti lè rí àwọn ọ̀bọ a lè rí nàkí a lè rí àdán a lè rí àwọn ẹran tí à ń rí nínú àwọn gbó wọ̀nyí ni wọ́n ti rí pé bóyá wọ́n ní àrùn yìí bí a ta bá ń sọ̀rọ̀ lọ a máa sọ àwọn àmì tá a lè rí lára ẹni tí ó bá ní àrùn.
ẹ ṣeun dókítà èèyàn kan ti sẹ́ǹdì SMS wa ó ní ṣé ó ṣeé ṣe láti pàdé àrùn yìí nínú òógùn ẹni tí àrùn ń ṣe. Is it possible to contact Ebola virus by having contact with the sweat of an infected person?
Like in a public place.
Like in a public place, you know. Doctor, what do you think about this?
Well, we have said it before.
Body fluids.
Body secretions. Body fluids. Sweat is part of the products, of the, what comes out of our body. And it is not unlikely that this sweat will also contain the virus. If the urine can contain it, if the blood can contain it,
if saliva can contain it,
then it's most likely that the infection, because it's a very, very deadly virus disease.
Now, just to thank the person who sent in the message, can Ebola virus be contacted through sweat? The doctor mentioned secretions, but didn't say anything about sweat. Most people hold on to railings in public places which they leave their sweat on. Is it possible to contact the virus this way? And that was Tunde. Tunde, the doctor has just responded to your question. I don't know if he has more to add.
Well, with respect to the complete question that I had now,
yes.
The virus too, they have limited time to survive outside the human body
or the animal.
So what we were talking about now, for somebody to sweat and then you have it on the railing, it depends on how long it lasted there. The time interval is very, very important. But of importance to us now is the issue of street personal hygiene, and in the form of frequent or regular hand washing.
Hand washing and having a bath twice daily, I would say. This kind of weather can be very hot and humid as much as possible. Hand washing is not as if it disinfects the hands, right, doctor? But that mechanical action that helps to dislodge bacteria and virus off our hands. Hand washing
with soap and water.
Okay, hand washing with soap and water. Because we have a lot of people who just go to the bathroom and rinse their hands.
Hand washing with soap
And water. That is the prescription. Now, ladies and gentlemen, you can join us by calling the number 0809 9120777. 0809 9120777. My name again is Fayo Williams, and with me today I have the consultant public health physician and state epidemiologist. His name is Dr. Ismail Abdus Salam. So if you have a question for us, you can go right ahead and call in. It's not every day you have an ojobo from the Ministry of Health at Alausa coming to join us on Traffic Radio. So right now we'll be going into the signs and symptoms of the Ebola virus disease. Doctor, we have a doctor, the consultant physician, and epidemiologist on the seat with us, and he will be telling us about the signs and symptoms of the Ebola virus disease. Doctor, over to you.
Well, the signs and symptoms, and that's where the disease is deadly. The initial signs and symptoms you have are similar to the signs and symptoms you have for normal malaria, for typhoid and other diseases, which are the person having fever, body ache, joint pain, malaise, feeling of unwell generally. So, and these are symptoms that are presented at the hospitals, and within this particular period too, the doctor will say he's treating for malaria, the nurse will have contact, do the vital signs, do the blood pressure and pulse rate. Meanwhile, the person is already infected and is passing the infection to them as well without any knowledge. Very difficult to know. It's just like Lassa fever, like yellow fever. They have the same family. The initial constitutional symptoms are not very specific. It's not specific for that particular disease. So because all these belong to the viral hemorrhagic fever family, they are called
big grammar.
Well, the big grammar that will there, I will break it. Hemorrhage is bleeding. Meaning that it's a viral infection caused by virus that also have symptoms that are bleeding symptoms, that you can bleed from all the different openings within our body.
So now, if they see a patient where they bleed, make they don't say now banjero na biko, just leave him like that. What do they have to do when we see these symptoms,
people with
signs?
The initial symptoms are there. By the time the patient is presenting with the bleeding symptoms, which might be bleeding from the nose, bleeding through the nose, to the eye, that's conjunctival hemorrhage, can bleed, passing blood by rectum, bleeding into the skin.
That is any time it passes out feces or urine, start
all these
bleeding.
for hematuria and co can come out. Anywhere there is opening, even from the hair, from the mouth, and everywhere. Openings from any part of our body, you have this bleeding coming out, and that is the late symptoms that we will have for people with this Ebola virus disease. And at this stage, so many other people would have been infected. Although we need to stress that not everyone that is infected will end up developing the disease.
Not everybody infected.
Because our immune system
differs
and will also respond to a foreign organism within the system. So the level and the extent of that immune system being effective will determine who comes down with the disease. But this is a very, very deadly disease. So more of the people that have the infection might end up developing that particular disease.
That's unfortunate. We want to know, or Femi wants to know, if there's a cure for this. Well, I wanted to come from the doctor himself.
Presently, research is still going on. No known drug. Vaccines, research on vaccine are still going on.
Not conclusive yet?
Yes, they are still working on it, but we cannot say. What we have now is what we call supportive therapy. That is, when the patient is had the disease and then we be supportive and preventive, because those that are treating too, we don't want them to contact the infection. We don't want the infection to spread to other people. We treat the symptoms.
Even the health workers.
The health workers.
What's our message to
the
health workers?
The health workers is highly at risk. So what we can say for health workers now is that, one, there should be what we call high index of suspicion. When you have patient presenting in the hospital with the constitutional symptoms that you have treated, and the patient is not getting better, still persistently having fever, and then you have tested for other forms of infection and you cannot get anything, what we call in our own parlance there, pyrexia or fever of unknown origin.
Pyrexia.
Pyrexia is fever.
No be tire o. No be say pyrexia na tire na fever.
Fever of unknown origin.
Fever wey we don't know the thing wey cause am. Na im we dey talk o.
You need to screen for Ebola, Lassa and other. Secondly is that at this point in time, which every health worker needs to observe while doing his work, is what we call universal safety precautions. Every point in time, you use protective clothing, you use your normal overall, you use your glove when you are attending to patient, your nose mask when it's applicable and you are attending to patient. You wash your hand frequently and regularly after attending to patient before even going to see patient. It's possible that health worker too is infected and can infect even the patient in the hospital. So it's a lot of presently I know that in Lagos State, for Lagos State Ministry of Health, we have tried to also sensitize the health workers both at the level of primary, secondary, and tertiary level, and public service announcement like what we're now
doing today.
Lagos State Government, Lagos State Ministry of Health, Lagos State Government are doing that in the different electronic and print media as well.
That is great. So just as a final word from you, Doctor, one word that our people, commuters, and Wololufe traffic radio, what they would take away on their journey with them today in order to stay away from this deadly disease?
Well, what they should know, one, that Ebola virus disease is a very deadly disease, and two, is that we should try to cultivate the habit of good personal and environmental hygiene.
Thank you. As in addition to that, stay away from uncooked bushmeat, improperly processed, particularly for those of us who stay in communities near the forests or near thick vegetation where you have gorillas, monkeys and that kind of thing inhabiting.
In addition, it has been known that bats are frequent in some areas, where they use as habitat. Lekki is one, Badagry area, and some other areas where I think it's important that those places they use as habitat should be fumigated. Fumigated, because they travel a lot. The migration level can migrate from different parts of Africa, West Africa to Nigeria and to other places. Very important that we do that.
Thank you. This has been a public health notification for all Lagosians. Stay safe. This is Fayo with them signing off and wishing you a happy Tuesday.